I'm coming at this as a journalist and a parent of a 4-year-old and a 1-year-old. We're not having any kind of questions coming from our 1-year-old, but our 4-year-old has talked to us about, Daddy, Mommy, I know we can't go to the park or to the library because of the coronavirus. And we tell her, yes, baby, you're right. But we don't know how far to take that conversation. And I'm sure there's a lot of parents out there who wonder, how much does my child need to know? How do I go about telling them all that's involved with the coronavirus and not scare them at the same time?
Okay. My first word of advice would be when children ask you questions about the coronavirus, uh, think the way the child is thinking rather than assume the child should think the way you think. For example, if your child says to you, I know we can't go outside because of the coronavirus, uh, you can acknowledge that and say yes, and then say something very simple that the child may very well be thinking, such as, that's kind of odd, isn't it? And then see if that simple statement will prompt a response on her part. In other words, if you show her, I'm willing to enter your world and think the way you're thinking, more likely than not, your child will elaborate or will at the very least recognize that mom or dad understands exactly what I'm talking about.
Are there places you shouldn't go? Are there things you shouldn't say to your child?
I don't think you should do things to alarm her. For example, talk about how a lot of people die because of this particular virus. In other words, there's no need bringing up topics that could cause alarm or anxiety for the child. If she asks, does this cause people to die? You can offer simple information such as, yes, some people have died the same way that some people die when they have the flu. That's kind of frightening, isn't it? And she may say, yes. Am I going to die? And you can say, probably not. That's not likely. But occasionally people do die, especially if they're older or they have some underlying disease. You don't want to give her false information, but you don't want to create alarm in her either.
Have you spoken to parents about this? And have you seen a lot of confusion on how to deal with this topic?
Well, I don't know that I've talked to a lot of parents about this particular topic. For one, I'm not talking to a lot of people these days outside my own family. My first reaction would be to say, to try to avoid the knee-jerk reaction to solve problems, to give pat answers, like this will go away or there's nothing to worry about. Like I said a moment ago, if we think the way the child thinks and say out loud the things we believe the child might be thinking or feeling, we may find that their concerns are much different than what we assumed they were, or they will say what they need to say. Uh, the big emphasis is on letting the child feel understood. Children who feel understood are much more likely to elaborate than children who feel thwarted or misunderstood.
So basically, get on their level and kind of let them direct where they need to go into the conversation.
Correct. In counseling, we refer to it as client-directed therapy. Same thing applies in family relationships. Child-directed conversation. Let the child direct the nature of the conversation, the topics that she or he want to discuss.
What do you suggest? Probably the last question. What do you suggest on kids who might have come into contact with information they necessarily shouldn't have? If maybe their friend tells them on the phone, or they see it on television, and they come to you with more information than you think a child should have, how do you diffuse that?
Well, if a child, for example, has been told that a lot of people have died as a result of this, one of the things she's going to do is watch your reaction as her parent. Are you going to become alarmed? Will you treat this as taboo information and she doesn't need to hear about those things? What we say through our behavior and our emotions will help to soothe the child. So we give the child an anchor to hold on to. If we are emotionally calm, cool, and collected, and we say to the child, yes, there's some truth to that, or no, that's not really the way it is, our explanation will be tempered by our calmness. And the child will take solace in the fact that we seem to be okay with that, and we seem to be controlled, and we seem to be have a handle on our emotions. That fact in and of itself is soothing and therapeutic to the child.
That's a wonderful way to look at it. You're saying your success in the conversation will have a lot to do with basically not a lot of what you're saying, just how you're reacting at the onset of
Correct. If I could say this, it's not my job, it's not your job to fix our world's problems, our child's problems. Our job is to help them draw conclusions about how they make sense of it all.
You mentioned something interesting I wanted to ask in that answer. I think you talked about how avoiding the topic or saying, "Oh, you don't need to worry about that," can sometimes do more harm than good, because then their mind will run.
If they're thinking about it already, to tell them to quit thinking about it isn't going to do any good. Remember, one of the things we want our child to leave with is this sense that mom or dad understands me. And so our guiding reaction or our guiding response should be, will this help my child feel understood? And that should guide what we say or do.
I think maybe a big mistake that parents make, myself included, is when my child has a worry. For instance, it's always, I'd like to end the conversation with, "Don't worry, baby, daddy won't let anything bad happen to you." Is that making a promise sometimes that I can't keep?
Yeah, okay, so that simple statement, ask yourself the question, am I trying to fix the problem for my child? Am I trying to push a solution where maybe it doesn't belong? If so, avoid those kinds of statements. You certainly want to give the child assurance that daddy's going to be here, mommy's going to be here, you've got me to hold on to, but avoid those kind of statements that you know aren't necessarily true, or you may or may not be able to fulfill them.
All right. Dr. Cotter, any final thoughts, any piece of advice you'd like to give to parents throughout this trying time?
Stay calm, stay cool, stay collected. Your child will listen to what you say and do as much as, or your child will listen to what you do and your emotional reactions as much as what you say to her.
Thank you so much, Dr. Cotter. I appreciate it.
You're welcome.